We've been at a plateau small cell for over 3 decades, actually, with platinum VP16 being the most effective therapy and nothing improving upon that. It's hard to get tissue in small cell. That's one of the problems. There are not a lot of surgical resections where you can look for panels. People are trying to do this, and something will come up. Same thing is true for squamous, and we're probably a little further along in trying to find some new targets in squamous with the people who are doing these genomic platforms, Washington University being one of the leaders in that area. In last year's ASCO, Dr. Govindan presented data about some of the things that might be important in squamous. So it will happen. And I kind of like to go back to the story about the EGFR mutation. So the EGFR inhibitors came out. People were saying this pathway is so complicated, it's going to be a decade before or more before we learn something about it. But it shows you that where there's a will, there's a way. And this is one of my favorite stories in oncology. So here's this kind of nihilism. We're not going to figure this pathway out. It's so complicated. It's not going to be like HER2 and breast cancer. And this all came about because of a patient that was treated in Boston, a young woman who was a nurse. I think she had 2 or 3 kids, never a smoker, had liver metastases, and she had been treated with chemo and it progressed, and she went on an EGFR inhibitor, had a spectacular response. And 2 or 3 years later, she's still in remission, and the Boston Globe wrote about it, and it was Tom Lynch's patient. And his boss at that time was Dan Haber, a breast cancer doctor, who read the Boston Globe that Sunday morning, called him up and said, "Tom, I think these patients have an EGFR mutation, a driver mutation. How many cases do you have like this?" And he said, "I don't know, 10 or 12. Do we have tissue?" They got the tissue. The rest is history. They sequenced the gene. Exactly what he predicted was found. EGFR mutation was found, and that was the driver. And the rest, of course, that's led to an explosion of work in the molecular biology of cancer. Before lung cancer, there was so much nihilism before that. And that was just a major event that just turned everything in the opposite direction. So it'll happen in squamous, it'll happen in small cell. I don't know exactly when, but somebody will come up with some idea somewhere and it'll work.